obesity and how it affects pregnant women. First off, pregnant women should not think that because they are pregnant, they are susceptible to COVID-19. It's still under study. It's that theory is still under study. It has not been confirmed yet. What we do know is that you should try as much as possible to wash your hands. You should wear mask, nose mask or face shield. Try as much as possible to avoid crowded areas. Eat healthy, take more fruits, vegetables, and plenty of water. It's going to help you a lot, especially the part where you avoid crowded areas. Either you wash your hands or you use a hand sanitizer. Make sure you do something. There's also a fear that if a mother is COVID-19 positive, if she can transmit it to her unborn fetus. That is also still in study. There are some COVID-19 positive mothers that they take the baby's amniotic fluid for testing, and they find out that it's negative, especially for those in their late trimester. So it's very possible, and for such, you know that except if there's any indication for CS, it's advisable to go through a vaginal delivery so that they can be able to heal up fast. If they should do a CS, the wound might take time to heal because their immunity is impaired. That is if there is no complication in the healing process. So it's very, very advisable they go through a vaginal delivery. You should try as much as possible to avoid depression, because at this point in time, we know that it's very easy to get depressed, thinking that because of your condition, it's very easy for you to get COVID-19, and because of your condition, the baby will have COVID-19. Don't worry about that. As long as you practice the precautionary measures that I earlier listed, don't worry about contacting. If you don't go through crowded areas, if you wash your hands, if you use sanitizer, if you use your nose mask and your face shield and eat well, you will just be fine. You'll be totally fine. Then one important thing for pregnant women is that you should be very careful of having a fever. A fever is very, very dangerous for the unborn fetus, especially in the early stage of pregnancy. If you notice that you have a fever, try as much as possible to visit the doctor. There could be other causes for fever which may not be coronavirus, but make sure you visit your doctor. Let your doctor carry out tests on you. Let him look at your history. Let him look at you clinically and see that okay, it is not corona, it is malaria, it is this and this and this. There are other causes. I'm not going to list everything here, but just make sure you see a doctor, because a fever is not good in early trimester. So make sure you visit the hospital regularly for checkups. Do not miss your antenatal visits. If you can, attend every antenatal visit that your doctor has scheduled for you. Try as much as possible not to get worried. Do not get into depression at this point in time. You need to be strong for yourself and for your baby. This is the time that your baby needs your strength the most. Pregnant women, there may be other concerns that you might have. Make sure you speak with your doctor about it. But at this point in time, we do not want pregnant women coming in with depression or coming in with hypertension. Try as much as possible to free your mind. Talk to your doctor about any question that you may have. It's going to clarify everything for you. But I want you to have it at the back of your mind that the fact that you're pregnant does not expose you or does not make you susceptible. It is still under study. It has not been confirmed. We cannot tell you that this certain age group gets corona more or this certain people, but we do know that people that have a predisposing or underlying condition, it they can easily predisposes them. People that have underlying condition, it predisposes them to easily be suppressed or easily be affected by COVID-19. Underlying conditions like hypertension, diabetes, kidney disease, any other underlying condition at all. If that person should have COVID-19 with such underlying conditions, it's possible, it exposes that person. The person will easily get affected. So if you do not have underlying conditions, make sure you keep your immunity at top notch. If you do have, try as much as possible to stick to the rules, to the laid down safety rules. Wash your hands, use sanitizer, use your nose mask. You can use a fabric nose mask. You don't have to use a medical nose mask, but make sure you wash it daily. Try as much as possible to stick to these rules. You will be fine. You and your baby will survive this period. All healthcare professionals, they are trying as much as possible to stay safe for you. We are trying as much as possible to stay safe so that we ourselves don't infect you. You know, you cannot be coming to the hospital to meet us and we will not infect. No, we are trying to stay safe for you. So you also stay safe for us. Don't bring it to us. Try as much as possible to stay safe. I want to shout out to every nurse out there. Thank you very much for the work you are doing. It's not easy, especially those on the forefront fighting corona, face to face. Thank you very much. God bless you. I pray that you would come out of this successfully. It's not easy. It's not easy, but it's a trying time that will pass. Thank you very much for listening to me. I'm still at work. I have to get back to work. I just wanted to disseminate this information that came to my mind right now. So have a nice day, pregnant women. Ciao.